All right, let's get right into this explainer. We're tackling high-yield cancer biology and oncology today. 12 crucial questions, back-to-back, let's go.
Question 1. Which of the following is not an established hallmark of cancer?
Okay, so the correct answer here is C. Evading autophagy actually isn't a primary hallmark. The actual 8 hallmarks include 6 of the classic alterations, things like self-sufficiency of growth signals and evasion of apoptosis, plus 2 emerging ones, reprogramming energy metabolism and evading immune destruction. Memorizing these? Absolutely crucial, because modern targeted therapies are literally designed specifically to disrupt these exact pathways.
Moving right along, question 2. Characteristics of tumorigenic transformation of cells include which of the following?
And the answer is D, immortalization. So normal cells naturally halt their proliferation via contact inhibition the second they form a confluent layer. But transformed cancer cells, they completely lose this anchorage dependence. They basically achieve immortalization, meaning they have this limitless replicative potential, which allows them to just endlessly pile up and form masses. Understanding this specific loss of regulation totally explains why tumors can grow so relentlessly and aggressively in host tissues.
Let's hit question 3. The cell cycle includes all of the following phases except.
Yeah, the answer is D. There is no G3 phase. The cell cycle strictly follows 4 distinct steps. You've got G1, preparation, S phase for copying genetic material, G2 preparation, and M phase, where cellular components actually partition into daughter cells. And non-proliferating cells, they just enter a quiescent G0 state. Grasping this cycle is super vital because a lot of traditional chemotherapies only target cells in specific active phases, meaning they leave those G0 cells completely untouched.
All right, question 4. All of the following factors are suggestive of a hereditary cancer except.
The answer here is C. Paraneoplastic syndromes are actually systemic signs caused by tumor secretions, like hormones. They definitely do not indicate a germline genetic lineage. Your true hereditary red flags are structural. We're talking tumor development at an unusually young age, bilateral disease in paired organs, multiple primary malignancies, or a cancer presenting in the less frequently affected sex. Spotting these flags is absolutely essential so you can initiate immediate genetic screening and family counseling.
Question 5. Anti-cancer chemotherapy agents include all of the following except.
Right, the correct answer is C. Prometabolites is literally just a fabricated term. The traditional cytotoxic classes actually include alkylating agents, anti-tumor antibiotics, plant alkaloids, and antimetabolites, which, by the way, are agents that structurally mimic necessary molecules to brilliantly and fatally disrupt cellular replication. You really need to identify these classes correctly when you're designing combination chemotherapy regimens to overcome tumor resistance.
Halfway through, question 6. Approved strategies for cancer chemoprevention include all of the following except.
The correct choice is A. Neurontin or gabapentin is an anticonvulsant and neuropathic pain medication. It has absolutely zero anti-neoplastic role. The other options, though, those are validated models. Selective estrogen receptor modulators like tamoxifen reduce high-risk breast cancer development. COX-2 inhibitors like celecoxib depress polyp burden, and 13-cis retinoic acid halts the progression of oral leukoplakia. Knowing these established therapies is a real game-changer for proactive intervention in high-risk patient populations.
Question 7. Which of the following displays a true biochemical characteristic of apoptosis, or its regulation in cancer cells? And the answer is D. Internucleosomal DNA cleavage, which results in that classic DNA laddering on gel electrophoresis, is the undeniable hallmark of apoptotic nuclear fragmentation. Just remember, caspases execute this cascade, whereas the Beclin-1 gene and chloroquine regulate or inhibit autophagy, not apoptosis. Distinguishing these distinct molecular pathways is honestly the key to understanding exactly how tumor cells successfully evade programmed death.
Question 8. Components of cancer invasion include which of the following? The correct answer is B. Integrins physically regulate cell to extracellular matrix adhesion and relay vital survival signals. Matrix metalloproteinases, or MMPs, they don't just enhance the matrix, they actively degrade it and break it down to permit invasion. Plus, keep in mind that in situ malignancies lie strictly above an intact basement membrane. Understanding this immediate microenvironment is so crucial for predicting how a localized tumor ultimately turns invasive. All right, question 9.
Which of the following statements is true of metastasis?
The answer is C. Metastasis is actually highly inefficient. I mean, millions of cells shed, but only a tiny fraction actually survive. This perfectly explains why curative resections are sometimes followed decades later by totally unexpected recurrences. This state of tumor dormancy is heavily regulated by the host's immunologic control over subclinical disease niches.
Down to the last few. Question 10. Which of the following is true regarding oncologic biomarkers?
The correct answer here is C. So prognostic markers describe natural history and survival regardless of therapy, whereas predictive markers identify the likelihood of response to a specific therapeutic agent. And when you combine multiple individual markers into multi-gene assays, that maximizes prognostic accuracy and gives you optimal survival predictability. Grasping this core clinical distinction is exactly what guides oncologists in tailoring precise, individualized treatment plans.
Question 11. Surgical resection of distant metastatic disease is enhanced by all of the following except. The answer is D. The mechanical choice between open versus minimally invasive surgery really doesn't alter oncologic outcomes, provided a complete, margin negative, or R0 resection is achieved. The true clinical drivers of a successful metastasectomy are rigorous patient selection, favorable tumor types, and a long disease-free interval. Basically, this highlights that surgical technique matters way less than simply achieving clear margins and ensuring proper patient selection.
And our final question, number 12. Which of the following is established as an improvement in cancer management?
The correct answer is A. Look, while conservative surgeries are definitely favored, radical approaches can't be eliminated entirely, and serum biomarkers still cannot replace gold standard tissue biopsies. But the massive established paradigm shift here is the use of advanced checkpoint inhibitor immunotherapy as standard first-line therapy for specific subsets of advanced non-small cell lung carcinomas. It's just an incredible leap forward, which really leaves us with one crucial question. What previously fatal cancer will immunotherapy conquer next?